So after she or any child has had the Kasai operation, we still were always watching to make sure she was staying as healthy as possible, because I know that there are increased potential for not side effects, but infections and risks of having the Kasai.
Yep.
So can you just talk us through what those extra risks are, and following through with that, what are the signs and symptoms that as a parent I should be looking out for to know to bring her back into hospital after the Kasai?
Sure. So in the weeks and months after a Kasai, it's really important in terms of that monitoring and the follow-up. And that includes how baby's growing, how baby's feeding, how the vitamins are going, and optimizing the levels, optimizing the dose to correct the levels and ensure that things are doing okay. And obviously with the bilirubin, making sure it's coming down and stays down. With the Kasai, we've changed the anatomy, and we've taken away one of the defences, if you like, in terms of bacteria entering the liver. So essentially now the bacteria can move up that part of the bowel that's been used for the drainage and into the liver. And there's a condition called ascending cholangitis. And we worry about that. So for the first year after a Kasai or after any episode of infection, we'd use preventative antibiotics that can help in terms of stopping that problem. But in addition, if a baby presents following a Kasai with a fever, or an increase in jaundice, or an increase in some other liver tests, we would treat quite aggressively in terms of ascending cholangitis. And what I mean by that is typically that might mean 2 weeks of IV intravenous antibiotics, along with an ultrasound and blood tests and monitoring and making sure things are responding. So in any baby that's had a Kasai that has a fever, if we can't explain it because of a sore throat or COVID or the flu or sore ears, we would want to treat for ascending cholangitis until we were proven otherwise. Obviously that has the short-term implications in terms of baby feeling not well, but one episode of cholangitis, a further episode, increases scar tissue within the liver and then can compromise how well bile leaves the liver into the gut and accelerate the need for transplant, for example.
Cool, understood. So yeah, you obviously talked about those are the signs and symptoms that were kind of non-negotiable to bring her back into the hospital. Are there any signs or symptoms that would be considered urgent that would need to call an ambulance?
Probably not in terms of calling an ambulance, but if the baby that's had a Kasai has a fever, it's really important to be seen that day.
Okay, as soon as
within
possible.
hours, but not within minutes. Okay. It's not immediately life-threatening, but it is really important to respond. It's not something that one would wait at home until the weekend's finished, sort of thing. But to head in, and to help facilitate that, we do have care plans, we're called blue cards, which means that babies that are in this situation can front up directly to the Children's Emergency Centre, not have to go through other steps to get seen and assessed.
Excellent.
And usually within that care plan, we would emphasise that we're worried about a temperature, and this would be the steps to consider and to do at that time.
So we talked about, the liver scarring over time after the Kasai and things that can accelerate that need for transplantation. So I guess from a parent's point of view, being told we have this Kasai operation is a temporary fix, essentially. What are the chances that the Kasai will work?
Sure.
Is there odds, is there any, what can we hold on to for hope that it's going to work or not?
Sure. So when the Kasai works well, so maybe a third of situations, the bilirubin within a few weeks has come down to normal. And in that situation, we'd be a little bit more relaxed, but we need to continue the monitoring and the assessments that we've mentioned. And in some of those cases, some of those children, they would grow up. I just saw a 13-year-old last week who's Kasai, drained early and is still doing well. When I was training, there was a young lady in her early 20s who was having a baby, for example, and the Kasai was working fine. But it's really important to continue to monitor and make sure it's continuing to work well, because there does remain the prospect that there'll be issues and that a transplant will be needed.
Okay.
In the worst case scenario, where there's no drainage and the bilirubin doesn't change at all, we're going to be even more anxious and monitor just that little bit more closely, because we'd be concerned that in that situation the baby will need to have a transplant early, maybe at 8 months, maybe at 12 months. And so it's it's monitoring in terms of all the basic things, but in addition looking for things that suggest that the liver is compromised and that arrangements for a transplant will be required. In the in-between group, which is probably again about a third of situations, we can be slightly relaxed in between in terms of monitoring, but looking out for worsening and for changes. And it might be that in that scenario, baby might need it, or the young child might need a transplant when they're 3 or 4, not when they're 8 months or 12 months.